Skip to content. Home new online current issue F for authors. Journals JAMA Cardiology JAMA Dermatology JAMA Facial Plastic Surgery JAMA Internal Medicine JAMA Neurology JAMA Oncology JAMA Ophthalmology JAMA Otolaryngology Head and Neck Surgery JAMA Pediatric JAMA Psychiatry JAMA Surgery Archives of Neurology and Psychiatry 1919 to 1959 Learning Story Apps Jobs Institutions/Librarians Reprints and Permissions Terms of Use Vertical Line Privacy Policy Vertical Line Accessibility Statement 2016 American Medical Association All rights reserved. JAMA Pediatrics Sign in Individual Sign in Create an account Institutional Sign in Open Athens Shibboleth Purchase Options Subscribe to the JAMA Pediatrics Journal Journals JAMA Cardiology JAMA Dermatology JAMA Facial Plastic Surgery JAMA the Internal Medicine JAMA Neurology JAMA the Oncology JAMA Ophthalmology JAMA the Otolaryngology Head and Neck Surgery JAMA Pediatrics JAMA Psychiatry JAMA Surgery Archives of Neurology and Psychiatry Skip to content landing Twitter Facebook Email More New Online Views 366 Citations 0 Viewed Metrics Download PDF Share Twitter Facebook Email Google LinkedIn Site to like Cite this permissions Editorial December 27, 2016 Has marijuana legalization increased marijuana use among U.S. youth? Wayne Hall, Ph.D. 1-2, Megan Wire, BPSSI 1 Author Affiliations Article Information 1 Center for Youth Substance Abuse Research, Royal Brisbane and Women's Hospital, University of Queensland, Hurston, Queensland, Australia. 2 Addictions Department, National Addiction Centre, King's College London, England. JAMA Pediator. Published online December 27, 2016. doi:10.1000/JAMA-Pediatrics.2016.3917. Editorial comment icon Editorial comment Related articles icon Related articles Author interview icon Author interview Multimedia icon Multimedia Editorial Understanding effect of changing legal status of marijuana on youth. Elaine Joff, MD, MPH. Original investigation. State recreational marijuana laws and adolescent marijuana use. Magdalena Surda, DR, PH, MPH. Melanie Wall, PhD. Tian Shufed, MS. Catherine M. Keith, Ph.D., Baron Sarvet, MPH, John Schulenberg, Ph.D., Patrick Mbombele, Ph.D., Rosalie Licardo Pacular, Ph.D., Sandro Galia, M.D., D.R. Ph., Deborah S. Hassan, Ph.D. Since 2012, citizens in Alaska, Colorado, Oregon, and Washington have voted to legalize the recreational use of marijuana by adults. Advocates of legalization have argued that prohibition wastes scarce law enforcement resources by selectively restricting minority users of a drug that has fewer adverse health effects than alcohol. 1 To it would be better, they argued, to legalize, regulate, and tax marijuana, like alcohol. 3 Opponents of legalization argue that it will increase marijuana use among youth because it will make marijuana more available at a cheaper price and reduce the perceived risks of its use. 4 Surda et al. 5 have assessed these concerns by examining the effects of marijuana legalization in Colorado and Washington on attitudes toward marijuana and reported marijuana use among young people. They used surveys from Monitoring the Future between 2010 and 2015 to examine changes in the perceived risks of occasional marijuana use and self-reported marijuana use in the last 30 days among students in 8th, 10th, and 12th grades in Colorado and Washington before and after legalization. They compared these changes with changes among students in states in the contiguous United States that had not legalized marijuana, excluding Oregon, which legalized in 2014. The perceived risks of using marijuana declined in all states, but there was a larger decline in perceived risks and a larger increase in marijuana use in the past 30 days among 8th and 10th graders from Washington than among students from other states. They did not find any such differences between students in Colorado and students in other U.S. states that had not legalized, nor did they find any of these changes in 12th graders in Colorado or Washington. If the changes observed in Washington are attributable to legalization, Why were there no changes found in Colorado? The authors suggest that this may have been because Colorado's medical marijuana laws were much more liberal before legalization than those in Washington. After 2009, Colorado permitted medical marijuana to be supplied through for-profit dispensaries and allowed advertising of medical marijuana products. This hypothesis is supported by other evidence that the perceived risks of marijuana use decreased and marijuana use increased among young people in Colorado after these changes in 2009.6. The health educational challenge after marijuana legalization. Marijuana legalization presents major challenges for prevention of use by youth. The risks of use are contested by proponents and opponents of legalization too, for making it difficult to provide broadly accepted messages about the risks of marijuana use. Health advice also has to compete with marketing by a legal marijuana industry that, like the alcohol industry, wants to grow its market by increasing regular use and downplaying its health risks. 7a The industry will protest that their promotions are intended only for adults, but adolescents cannot be insulated from their messages. The challenge for health educators will be in acknowledging that the acute adverse effects of marijuana use are modest by comparison with those of alcohol or heroin, while persuading young people that they can experience adverse effects, especially if they begin use in their teens and use daily throughout young adult life. 910 Marijuana users need to be informed about the approximate doubling of the risks of a collision if they drive while intoxicated. 11 Especially if they use both alcohol and marijuana. 9 Regular users need to be aware that they can develop dependence. 9 The risk for dependence is about 1 in 10 for those who ever use marijuana and 1 in 6 for those who first use in adolescence. 12 Marijuana users also need to know that dependent users have more anxiety, depression, and psychotic disorders and are more likely to leave school early, to be unemployed as adults, and experience downward social mobility in mid-adulthood. 9-13-14 Debate will no doubt continue over whether regular use is a contributory cause to these outcomes or if these outcomes occur because regular users have a higher risk of these poorer outcomes before they start to use. 9. The challenges of future policy evaluation. Future evaluations of the effects of marijuana legalization on use and harms will require studies of larger, more representative state samples over longer periods. 8 These evaluations will be affected by how many U.S. states legalize marijuana and how soon they do so. If a legalization bandwagon develops like the bandwagon that led to the repeal of national alcohol prohibition in 193,215, then future evaluations of legalization will be limited to comparing trends in marijuana use in the United States and other developed countries that have not legalized. Policy evaluations would be difficult even if equal numbers of U.S. states, with similar social and ethnic composition, decided to legalize marijuana or not. Comparisons of trends in perceived risks between states would be complicated by the probable spillover effects of policy debates about marijuana. The perceived risks of using marijuana have already declined nationally, probably because of a number of reasons. Increased marijuana use because users perceive use as less risky than non-users. Increased media coverage of the medical uses of marijuana now legal in 23 states and public debates about ballot initiatives for legalization in which advocates have argued that marijuana use has far fewer adverse health effects than alcohol. Assessing the effects of marijuana legalization on use will also be complicated because price differential between states where marijuana is legalized versus not legalized will probably encourage marijuana smuggling and reduce average marijuana prices in states without recreational marijuana use laws. Back to top. Article information. Corresponding author, Wayne Hall, Ph.D., Centre for Youth Substance Abuse Research, The University of Queensland, Hurston, Queensland 4029, Australia. w.hall@uq.edu.au. Published online, December 27, 2016. doi:10.1001/JAMA Pediatrics.2016.3917. Conflict of interest disclosures. None reported. References. 1. Marijuana Policy Project. Top 10 Reasons to End Marijuana Prohibition by Taxing and Regulating Marijuana. https://www.mpp.org/issues/legalization/top 10 Reasons to End Marijuana Prohibition/ Accessed September 26, 2016. 2. Marijuana Policy Project. Marijuana is safer than alcohol. It's time to treat it that way. https://www.mpp.org/marijuana is safer/ Accessed September 26, 2016. 3. Marijuana Policy Project. Effective arguments for advocates of regulating and taxing marijuana. https://www.mpp.org/issues/legalization/effective arguments for regulating and taxing marijuana/ Accessed September 26, 2016. 4. Subet A.A. The often unheard case against marijuana leniency. In Early Wyndham, said. Pod Politics, Marijuana and the Costs of Prohibition. Oxford, England, Oxford University Press, 2006:325-352. 5. Serta M. Wall Fenty, et al. Association of State Recreational Marijuana Laws with Adolescent Marijuana Use, published online December 27, 2016. JAMA Tour. doi:10.1001/JAMA-Pediatrics.2016.3624. 6. Schwerme J. Salad Monsanto Tel S. Price Arcade, et al. Temporal Trends in Marijuana Attitudes, Availability and Use in Colorado compared to Non-Medical Marijuana States, 2003-11. Drug Alcohol Depend. 2014 140:145-155. PubMed article. 7. Calkins J.P., Kilmer B., Kleiman March, et al. Considering Marijuana Legalization, Insights for Vermont and Other Jurisdictions. Santa Monica, CA, Rand Corporation, 2015. 8. Hall W., Linsky M. Why it is probably too soon to assess the public health effects of legalization of recreational cannabis use in the USA. Lancet Psychiatry. 2016 39:900-906. PubMed article. 9. Hall W., Degenhardt Adverse Health Effects of Non-Medical Cannabis Use. Lancet. 2009 374 9698:1383 1391. PubMed article. 10. Hall W. What has research over the past 2 decades revealed about the adverse health effects of recreational cannabis use? Addiction. 2015 110 1:1935. PubMed article. 11. Asbridge M., Hayden G. A., Cartwright J. L. Acute Cannabis Consumption and Motor Vehicle Collision Risk, Systematic Review of Observational Studies and Meta-Analysis. BMJ. 2012 344:536. PubMed article. 12. Anthony J. The Epidemiology of Cannabis Dependence. In Hoffman R.A., Stevens Hars, eds. Cannabis Dependence, Its Nature, Consequences and Treatment. Cambridge, England, Cambridge University Press, 2006:58-105. 13. Serta M. Moffat T.E., Meyer Marshall Islands, et al. Persistent cannabis dependence and alcohol dependence represent risks for midlife economic and social problems. The longitudinal cohort study. Clinicol SCI. 2016 for 6:1028-1046. doi:10.1017/2quadrillion-167,716,616,630,958 article. 14. Volko and E. Taylor Road, Compton W.M., Vise S.R. Adverse Health Effects of Marijuana Use. N. Ingle J. Medicine. 2014 373:2219-2227. PubMed article. 15. Shrap milliliters. The Political Power of Bad Ideas, Networks, Institutions, and the Global Prohibition Wave. Oxford, England, Oxford University Press, 2010. See more about Adolescent Medicine, Pediatrics, Substance Use and Addictive Disorders. Download PDF. Cite this. Citation. Hall W. Wire M. Has marijuana legalization increased marijuana use among U.S. youth? JAMApedia Tour. Published online December 27, 2016. doi:10.1001/JAMApediatrics.2016.3917. Download citation file. Arise Zotero EndNote by Tex Medlers Prosite Riffworks Reference Manager Mendeley Sci2like. Copyright 2016. Permissions. Icon Stethoscope. Physician Jobs. Find pediatrics jobs now. X. JAMA. Content Home New Online Current Issue. Journal information for authors, editors and publishers. RSS Contact Us. Learning Store Apps, Jobs, Institutions, Reprints and Permissions. Subscribe Go. The JAMA Network. Journals: JAMA, JAMA Cardiology, JAMA Dermatology, JAMA Facial Plastic Surgery, JAMA the Internal Medicine, JAMA Neurology, JAMA the Oncology, JAMA Ophthalmology, JAMA the Otolaryngology, Head and Neck Surgery, JAMA Pediatrics, JAMA Psychiatry, JAMA Surgery, Archives of Neurology and Psychiatry 1919 to 1959. Sites: AMA Manual of Style Art and Images in Psychiatry, Breast Cancer Screening Guidelines, Colorectal Screening Guidelines, Declaration of Helsinki, Depression Screening Guidelines, Evidence-Based Medicine and Oral History, Health Disparities, Hypertension Guidelines, JAMA the Network, Audio Medicine, Medical Education, Opioid Management Guidelines, Peer Review, Congress, Sepsis and Septic Shock, Statins and Dyslipidemia. Topics and collections. Featured articles: ACS Breast Cancer Screening Guidelines, CDC Guideline for Prescribing Opioids, Consensus Definitions for Sepsis and Septic Shock, Income and Life Expectancy in the U.S., JNC8 Guideline for Management of High Blood Pressure, President Obama on U.S. Healthcare Reform, Screening for Colorectal Cancer, Screening for Depression in Adults, Statins for Primary Prevention of Cardiovascular Disease, WMA Declaration of Helsinki. 7th Revision. Blogs: JAMA the Internal Medicine blog, the JAMA Forum. Topics in Ophthalmology. Information for authors, institutions and librarians, advertisers, subscription agents, employers and job seekers. Media. JAMA Network Products, AMA Manual of Style, JAMA Evidence, JN Challenge, JN Reader, Peer Review, Congress. Learning CME quizzes about CME and mock reporting preferences. Help. Subscriptions and renewals. Email subscriptions. Update your address. Contact us. Frequently asked questions. JAMA Career Center Physician Job Listings. Get the latest from JAMA Pediatrics. Sign up. 2016 American Medical Association. All rights reserved. Terms of use. Vertical line privacy policy. Vertical line accessibility statement. Sign in to access your subscriptions. Sign in to your personal account. Institutional sign in. Open Athens vertical line Shibboleth. Create a free personal account to download free article PDFs, sign up for alerts, and more. Purchase access. Subscribe to the journal. Buy this article. Sign in for access to learning. Sign in to your personal account. Create a free personal account. The free personal account provides access to CME for a limited time only. Free quizzes on the JAMA Network Challenge. Sign in to download free article PDFs. Sign in to access your subscriptions. Sign in to your personal account. Institutional sign in. Open Athens vertical line Shibboleth. Create a free personal account to download free article PDFs, sign up for alerts, and more. The free personal account provides free current issues on the JAMA Network Reader, free quizzes on the JAMA Network Challenge, personalized alerts. Yes. Alert me when new content is published. Privacy policy.